What is the primary responsibility of a registered nurse, RN, in a healthcare setting? A. Administering medications. B. Conducting surgeries. C. Managing hospital finances. D. Maintaining hospital facilities. Which of the following tasks is typically performed by a registered nurse, RN, during patient assessment? A. Drawing blood samples. B. Analyzing X-ray images. C. Conducting physical examinations. D. Performing surgical procedures. What is the role of a registered nurse, RN, in developing patient care plans? A. Prescribing medications. B. Managing hospital resources. C. Implementing treatment protocols. D. Collaborating with healthcare team members. Which of the following is a critical skill for a registered nurse, RN, to possess? A. Carpentry. B. Plumbing. C. Active listening. D. Electrical engineering. What is the purpose of documenting patient information by a registered nurse, RN? A. For entertainment purposes. B. To maintain patient confidentiality. C. To sell patient data. D. To facilitate communication among healthcare providers. Which of the following is a responsibility of a registered nurse, RN, in providing patient education? A. Ignoring patient questions. B. Providing information about medical procedures and conditions. C. Restricting access to healthcare resources. What is the role of a registered nurse, RN, in managing patient pain? A. Ignoring patient complaints. B. Providing emotional support. C. Withholding pain medications. D. Causing pain intentionally. Which of the following is a requirement for becoming a registered nurse, RN, in most jurisdictions? A. Completion of a medical residency program. B. Possession of a valid nursing license. C. A degree in electrical engineering. D. Proficiency in carpentry skills. What is the role of a registered nurse, RN, in infection control? A. Spreading infections intentionally. B. Following proper hand hygiene protocols. C. Ignoring infection control guidelines. D. Refusing to wear personal protective equipment. Which of the following is a common duty of a registered nurse, RN, in a surgical setting? A. Operating heavy machinery. B. Administering anesthesia. C. Assisting with surgical procedures. D. Serving food to patients. What is the primary focus of a registered nurse, RN, in a mental health setting? A. Providing dental care. B. Administering vaccines. C. Assessing and supporting patients' mental well-being. D. Repairing broken bones. What is the significance of maintaining accurate medical records for a registered nurse, RN? A. To confuse healthcare providers. B. To facilitate continuity of care and treatment planning. C. To endanger patient safety. D. To violate patient privacy. Which of the following is a critical aspect of a registered nurse, RN's role in emergency care? A. Ignoring emergency calls. B. Administering first aid and life-saving measures. C. Refusing to respond to emergencies. D. Delaying treatment for patients. What is the purpose of collaborating with other healthcare professionals as a registered nurse, RN? A. To isolate patients from other healthcare providers. B. To provide comprehensive and holistic care to patients. C. To delay patient treatment. D. To compete with other healthcare professionals. Which of the following is a duty of a registered nurse, RN, in palliative care? A. Administering aggressive treatment. B. Providing comfort and pain management. C. Ignoring patient suffering. D. Refusing to communicate with patients' families. What is the role of a registered nurse, RN, in promoting patient safety? A. To endanger patient safety intentionally. B. To follow safety protocols and guidelines. C. To ignore safety concerns. D. To avoid patient interactions. How can a registered nurse, RN, effectively communicate with patients? A. By using medical jargon and complex terminology. B. By providing clear and understandable explanations. C. By refusing to answer patient questions. D. By ignoring patient concerns. What is the significance of providing emotional support to patients as a registered nurse, RN? A. To exacerbate patient distress. B. To promote patient comfort and well-being. C. To ignore patient emotions. D. To avoid patient interactions. Which of the following is a responsibility of a registered nurse, RN, in long-term care settings? A. Providing short-term treatment. B. Disregarding patient needs. C. Managing acute medical conditions. D. Providing ongoing care and support. What is the role of a registered nurse, RN, in promoting health education and prevention? A. To discourage healthy behaviors. B. To provide information and resources for disease prevention. C. To promote unhealthy lifestyle choices. What is the role of a registered nurse, RN, in assisting with patient mobility? A. To discourage patients from moving. B. To provide support and assistance for safe movement. C. To ignore patients' mobility needs. D. To restrict patients' movement. How does a registered nurse, RN, contribute to patient advocacy? A. By prioritizing personal interests over patient needs. B. By speaking up for patients' rights and interests. C. By disregarding patients' concerns and preferences. D. By avoiding involvement in patient care decisions. What is the primary responsibility of a registered nurse, RN, during medication administration? A. To administer medications without verifying patient identity. B. To provide incorrect dosages of medications. C. To verify prescriptions and administer medications safely. D. To ignore medication schedules and protocols. How does a registered nurse, RN, promote infection prevention in a healthcare setting? A. By ignoring proper hand hygiene practices. B. By failing to use personal protective equipment. C. By following infection control protocols and guidelines. D. By intentionally spreading infections. What is the significance of continuing education for registered nurses, RNs? A. To hinder professional growth and development. B. To maintain current knowledge and skills in nursing practice. C. To discourage learning and innovation. D. To avoid adapting to changes in healthcare practices. How does a registered nurse, RN, contribute to patient safety during procedures? A. By rushing through procedures without proper preparation. B. By ignoring safety protocols and guidelines. C. By ensuring proper patient identification and site verification. What is the role of a registered nurse, RN, in end-of-life care? A. To prolong life at all costs. B. To provide comfort and support to patients and families. C. To avoid discussing end-of-life preferences with patients. D. To ignore patients' wishes regarding end-of-life care. How does a registered nurse, RN, ensure effective communication with other healthcare team members? A. By withholding information from colleagues. B. By using unclear and ambiguous language. C. By actively participating in interprofessional collaboration. D. By disregarding input from other team members. What is the significance of maintaining professional boundaries for a registered nurse, RN? A. To engage in inappropriate relationships with patients. B. To prioritize personal interests over patient care. C. To ensure ethical and professional conduct in patient interactions. How does a registered nurse, RN, contribute to healthcare quality improvement initiatives? A. By resisting changes and improvements in practice. B. By actively participating in quality improvement projects and initiatives. C. By ignoring patient feedback and concerns. What is the role of a registered nurse, RN, in patient advocacy? A. To prioritize hospital policies over patient needs. B. To ensure patients receive appropriate care and treatment. C. To avoid addressing patients' concerns and preferences. D. To dismiss patients' rights and autonomy. How does a registered nurse, RN, contribute to interdisciplinary collaboration in healthcare? A. By working independently without consulting other healthcare professionals. B. By actively participating in care coordination and team meetings. What is the primary responsibility of a registered nurse, RN, during patient discharge? A. To provide minimal instructions and support to patients. B. To ensure patients understand their discharge instructions and follow-up care plans. How does a registered nurse, RN, ensure patient privacy and confidentiality? A. By sharing patient information with unauthorized individuals. B. By discussing patient information openly in public areas. C. By maintaining confidentiality and only sharing information on a need-to-know basis. What is the significance of evidence-based practice for registered nurses, RNs? A. To rely solely on personal experience and intuition in patient care. B. To base nursing practice on current research evidence and best practices. How does a registered nurse, RN, promote patient safety during medication administration? A. By administering medications without verifying patient allergies. B. By double-checking medications and dosages before administration. What is the role of a registered nurse, RN, in providing culturally competent care? A. To avoid working with patients from diverse cultural backgrounds. B. To provide care that respects and incorporates patients' cultural values and preferences. How does a registered nurse, RN, contribute to infection prevention and control in a healthcare facility? A. By neglecting proper hand hygiene practices. B. By encouraging the spread of infections among patients and staff. C. By adhering to infection control protocols and guidelines. What is the role of a registered nurse, RN, in advocating for patient rights? A. To disregard patients' rights and preferences. B. To ensure patients are informed about their rights and have their voices heard. C. To avoid addressing patients' concerns and complaints. How does a registered nurse, RN, promote patient education and empowerment? A. By withholding information from patients. B. By providing clear explanations and educational materials. C. By discouraging patients from taking an active role in their healthcare decisions. What is the role of a registered nurse, RN, in assessing and managing patient pain? A. To dismiss patient reports of pain. B. To provide appropriate pain assessment and management interventions. C. To administer pain medication without assessment. How does a registered nurse, RN, contribute to patient education about medication management? A. By avoiding discussions about medications with patients. B. By providing information about medication purpose, dosage, and potential side effects. C. By giving medications without informing patients. What is the significance of therapeutic communication for registered nurses, RNs? A. To ignore patient concerns and emotions. B. To establish trusting relationships with patients and promote healing. C. To avoid communicating with patients. What is the role of a registered nurse, RN, in preventing falls in hospitalized patients? A. To ignore fall risks and hazards. B. To implement fall prevention strategies and assess patients' mobility. C. To encourage risky behavior that may lead to falls. How does a registered nurse, RN, promote patient autonomy and decision-making in healthcare? A. By making decisions for patients without their input. B. By respecting patients' rights to make informed choices about their care. C. By ignoring patients' preferences and concerns. What is the role of a registered nurse, RN, in responding to medical emergencies? A. To panic and avoid taking action. B. To assess the situation, initiate appropriate interventions, and summon additional help as needed. C. To leave the scene and avoid involvement.